Welcome back to the Neurostimulation Podcast. I'm Dr. Michael Passmore, Clinical Associate Professor in the Department of Psychiatry at the University of British Columbia in Vancouver, Canada. Today's episode is a continuation on the course on transcranial direct current stimulation, or tDCS. This is a course that is following the textbook on tDCS called The Practical Guide to Transcranial Direct Current Stimulation. This is a foundational reference for clinicians and researchers alike. So whether you're a neuromodulation specialist, a graduate student, a researcher, or a curious clinician, we're going to continue in our exploration of this textbook to learn how tDCS works, starting with the physics that it's based on, all the way through to its physiological effects, and ending up with a look to see where this exciting field is headed. In today's episode, we're going to explore how direct current, or DC stimulation, has expanded well beyond traditional transcranial neurostimulation methods. From the brain to the spinal cord and the cerebellum, DC-based neuromodulation is moving into new clinical frontiers, and we're here to unpack it together. So let's start with, what do we mean by DC-based neuromodulation? When people hear tDCS, or transcranial direct current stimulation, they usually think of stimulation applied to the scalp to influence cortical excitability. This is correct, but in fact, non-invasive DC stimulation encompasses more than just tDCS. This chapter is going to introduce us to three primary targets of DC-based neurostimulation. The first is tDCS, which is applied over the cerebral cortex. The second is cerebellar DC stimulation, which is applied over the cerebellum. And the third is transcutaneous spinal DC stimulation, or tsDCS, which is applied over the spinal cord. Each targets a different part of the nervous system with unique applications and protocols. Now let's talk about the electrodes. So this is the interface between the device that generates the electricity, the direct current in this case, and the nervous system that's being affected. The essential setup includes the target electrode, which directs the stimulation, and the return electrode, which completes the circuit. The electrode design matters, whether it's metal, conductive rubber, or plastic filled with saline or gel. Electrode size and placement significantly affects current density and the resulting stimulation focality. One key point is that small electrodes allow more focused stimulation, potentially improving precision for things like selective muscle activation or task-specific motor rehabilitation. Let's look at the foundational method now. tDCS remains the most researched and widely used form of non-invasive DC neurostimulation. It delivers a low amplitude, sustained current to the scalp to modulate brain activity. The most common electrode montage or placement on the scalp is the anode electrode over the motor cortex and the cathode electrode over the contralateral, or opposite, supraorbital area, the area above the orbit or eye. tDCS is widely applied for treatment of conditions like depression. It's showing promise in treatment of aspects of stroke rehabilitation, as well as in cognitive enhancement. But tDCS isn't alone in this game anymore. Let's look at another one, the second in our list, cerebellar DC stimulation. Why stimulate the cerebellum? The cerebellum is situated here at the base of the brain, at the back. It's at the top of the spinal cord and underneath the occipital lobes of the brain. And the cerebellum is important because of three main things. It's involved in the modulation of motor control, so it helps to smooth out coordination and the fluidity of movements. Dexterity is really important for cerebellar control, as it is in regulating balance and coordination when we're doing complex motor activities. But it's also involved in modulation of cognitive processes, as well as in emotional processing, which a lot of people don't realize. Cerebellar tDCS has therefore been tested for treatment of such conditions as ataxia, or instability while walking, Interestingly, because of the cerebellar's role in things like emotional control and emotional processing, cerebellar tDCS has been tested in conditions like bipolar disorder, which obviously involves instability of mood control. Other conditions that cerebellar tDCS has been tested in include obsessive compulsive disorder or OCD and chronic pain conditions. The electrode placement or montages in these variable applications typically place the active electrode over the midline or on one cerebellar hemisphere, with the return electrode on the shoulder or the cheek. Clinical studies are showing promise. For instance, cerebellar tDCS was shown to improve sleep in bipolar disorder patients, and it's also been shown to help alleviate obsessive compulsive disorder symptoms. Now let's look at spinal cord stimulation, or tsDCS. The spinal cord may seem like an unlikely target for surface non-invasive neurostimulation, but tsDCS appears to work. Cathodal or anodal current over the thoracic or cervical spine can alter things like segmental reflexes, pain perception, and motor unit recruitment. Potential clinical applications include things like treatment of restless leg syndrome, spinal cord injury, and motor neuron excitability in conditions like ALS, amyotrophic lateral sclerosis, otherwise known as Lou Gehrig's disease, or multiple sclerosis. Placement or montages of electrodes can vary, with the return electrodes on places like the shoulder, the abdominal wall, or the vertex, the very top of the head, depending on the desired spinal target. Now, what about home-based applications and the democratization of tDCS and these other non-invasive neurostimulation treatments? Unlike RTMS, or repetitive transcranial magnetic stimulation, DC current-based methods are portable, affordable, and can be safe for home use with clinical supervision. Many studies have validated remote supervision protocols for treatment of things like psychosis, stroke, tinnitus, and symptoms of multiple sclerosis. This opens the door for remote, scalable treatment options, including in areas like neurorehabilitation, even in remote or underserved communities. However, a word of caution: the simplicity of tDCS also makes it potentially easy to misuse. This means that medical supervision and standardized treatment protocols will be essential to ensure that these treatments can be used safely and targeted appropriately. Now let's look at some clinical applications and consider some case highlights. Let's run through a few case-based examples. What about bipolar disorder? Well, studies have shown that cerebellar tDCS can improve symptoms like sleep and improve function during the day. It has been studied in conditions like Parkinson's disease, where tDCS has been shown, when applied over the motor cortex or cerebellum, to improve movement disorder subscores in certain patients. In depression, prefrontal cerebellar montages has been shown to lead to symptom improvements in treatment-resistant patients. These kinds of studies underscore the importance of target selection, polarity, and protocol duration, as well as the need for development of personalized approaches to treatment. Let's look at some challenges and look ahead to see what's on the frontier. Despite these kinds of studies that show exciting progress, there are certain key challenges that remain. The first is the lack of consistent standardized protocols across research sites, which is still in development, and hopefully we'll be getting some more consensus on that can be incorporated into clinical practice guidelines in the near future. The second is high inter-individual variability, which on the one hand needs to be reinforced by replicated studies in large populations, but on the other hand can underscore the importance of personalization and how these treatments might be part of a comprehensive approach to treatment of individual situations, perhaps not just with neurostimulation, but in addition to other treatments like physical therapy, pharmacotherapy, counseling, so that an individual person can take advantage of multiple different treatment options in order to get the best benefit for their particular situation at that given point in time. The third is the need for focal targeting and modeling of the specific electrical current that's being delivered. These lead to ongoing questions around dose response and optimal frequency of treatment in terms of the duration and the total course, the length of the course of each specific. This includes factors such as specific electrical dose response relationships, as well as the optimal frequency and duration, not only of individual sessions, but of entire courses of treatment in terms of the neurostimulation that's being offered. And so here's where modeling and things like closed loop systems and even artificial intelligence assisted protocols can play an increasingly important role over the next years. So in closing, non-invasive DC-based neuromodulation is certainly evolving from lab-bound protocols to home-based, remote, supervised use. Things like tDCS, cerebellar DC stimulation, and tsDCS, spinal cord stimulation, may soon represent a triad of tools for neurologic and psychiatric care, as well as in other fields like physical medicine and rehabilitation. These therapeutic options are simple to use, they're low cost and scalable, potentially accessible to people who are in underserviced and more remote areas, and therefore they can be potentially transformative in terms of improving health and wellness. Thanks again for tuning in. I hope that you enjoyed today's episode. Please be sure to like and subscribe, leave a comment or a review, ask questions in the comment section below, and don't forget to share this episode with someone that you think might be interested in the discussion that we had today, as well as in joining us on our exploration of this tDCS textbook so that we can continue to learn all about this revolutionary technology and how it will hopefully be beneficial for many people in the coming years. Also, let us know if you have any ideas about other topics that you would like to be explored on the show. Until next time, thanks again for tuning in. I really appreciate your time, your interest, and your attention. So stay well, stay curious, and we'll see you next time on the Neurostimulation Podcast.